out there, it is another week of victories, courage, love and care for one another as the global efforts to contain the coronavirus pandemic are gradually succeeding. I am Koinsola Adetumbi and you are watching The Diaspora. To enhance efficiency, effectiveness, as well as to assist the Nigerians in Diaspora Commission, NIDCOM, in delivering its mandates, the Nigerian Ports Authority, NPA, as its corporate social responsibility as well as interagency collaboration, graciously donated computers and other office equipment to the Commission. Take a look.
For Diaspora.
Diaspora compliant.
Actually, what?
I don't want to cover. I don't want to cover the. Okay. Come on.
These computers to the Nigerian Diaspora Commission.
On behalf of Nigerian Diaspora Commission, we gladly receive this generous gift from the NPA. We're very grateful and we promise that we will make good use of these much needed items, especially at this point in time in the life of the Commission. Thank you very much.
It is my singular pleasure to be given the opportunity to hand over these items to you on behalf of the Managing Director, Hadiza Bala Usman. Nigerian Port Authority is donating these items this afternoon, comprising 20 desktops, 10 laptops, 2 printers and accessories to Nigerian Diaspora Commission with the aim of improving its working capacity towards meeting the Commission's mandate. It is not unconnected with the fact that Nigerian Port Authority is a responsible corporate organization that is mindful of needs of sister MDS. Therefore, we wish to donate these items under our corporate social responsibility. On behalf of the Managing Director, the management, staff of Nigerian Port Authority, I hereby deliver the items and convey the assurance of the Managing Director's commitment for national development. Thank you and good afternoon.
Thank Nigerian Ports Authority enough for the thoughtfulness of your corporate social responsibility. And this is what governance is about. A sister agency helping a new sister agency. And at a time when, you know, of course, all our computers, printers have been locked up, for you to give us this many, I mean, you've just made our day. Let's appreciate you once more. So on behalf of all staff of the Commission, I want to say a big thank you to the Nigerian Ports Authority. I'm not surprised that the MD, Hadiza Bala Usman, is a woman. Extending a hand of support and friendship to another woman. And I really want to use the opportunity to say a big thank you to the First Lady of the Federal Republic of Nigeria. She's been very supportive during these trying times. So also has the Minister of Finance, Hajia Zainab Ahmed. I want to say thank you again, Nigerian Ports Authority, for your hand of fellowship, your hand of support to your sister organization. We assure you that we'll be working with your organization and other organizations for the growth and development of our country, Nigeria. Thank you very much.
Graduates and undergraduates and the rest, they made it. They've already distributed a sample more in the state, in the community. And this is just to be brought to the Diaspora Commission.
And they are saying they want to come back home go into manufacturing, go into small businesses. When they finish what they're doing, and there's no better time than now to come back home,
Exactly.
you know, after all this COVID thing. So we're glad that our youth are getting very, very creative, thinking outside the box, and going into manufacturing.
As at today, not less than 20 Nigerians in the diaspora have lost their lives due to the coronavirus pandemic. We empathize with all families and we pray this pandemic comes to an end soon. In the course of this, we would also like to appreciate all health workers working on the front lines in the fight against the COVID-19 pandemic. We are super grateful and we in no small measure take you for granted. You are the true heroes. Join me as we celebrate some of these heroes.
Irreplaceable simply means impossible to replace if lost or damaged. This is the opinion of probably innumerable people that had the fortune of being treated by Dr. Olagunju Ogunbiyi, the Nigerian diaspora who has been practicing medicine in the United Kingdom for many years. His discharge from the hospital went viral after battling COVID-19 for over 2 weeks. Olagunju Ogunbiyi is a consultant general in general surgery. His subspecialties include colorectal gastroscopy (OGD), colonoscopy, flexible sigmoidoscopy, and gastrointestinal cancers. When he took ill, his employers, his colleagues, and family rallied for the best medical care the UK could offer to save him, knowing that sufferers of his age like him died from the virus. Which is why tons of people gathered outside the hospital ward full of cheers as he was wheeled out. The COVID-19 survivor expressed his gratitude for the support of the selfless medicals and many well-wishers. The news attracted President Muhammadu Buhari, who was extremely happy about Dr. Ogunbiyi's recovery and proud that the doctor set an impression of a good Nigerian for people to support him at his time of distress. Dr. Ogunbiyi has mentored generations of promising young doctors in the UK. He is an eminent surgeon at the Royal Free Hospital, one of UK's leading reference hospitals of international standing. He is regarded by health workers as an asset to Europe and Nigeria, an enviable personality who has and still is demonstrating the true Nigerian resilience and professional excellence. Professor Aliko Baba Ahmed started his medical career in Nigeria after an MBBS degree in ABU Zaria. He is a specialist in infectious diseases, covering epidemic preparedness and responses. He later became a research associate, Global Consortium for Mental Health Policy between 1985 and 2002 in Nigeria and Holland. He was once a specialist registrar in public health, National Health Service (NHS), consultant in communicable diseases, consultant in public health care and quality, Executive Director of Public Health and Honorary Professor of Public Health between 2002 and 2015 in the UK. Professor Ahmed became a Senior Fellow and Executive Member, Cambridge Institute of Public Health, University of Cambridge, East of England, and Regional Director, National Health Service (NHS). He is a distinguished personality with exceptional and outstanding achievements among the Nigerian diaspora working in the health sector. His portfolio include oversight and general responsibility for improving and protecting the health of the populace and reducing health inequalities. As a senior fellow, he is to provide evidence-based policy analysis and options for UHC, provide leadership and convene health policy dialogues and debates for sustainable health systems in resource-constrained settings. Professor Aliko Baba Ahmed, a professional and eminent Nigerian, has won many awards for his impactful work in public health in the UK, spanning 24 years. He has 3 publications to his credit.
And now we bring to your screen the COVID-19 soundbites. Let's join Dr. Olorunda Rotimi, a histopathologist at the Leeds University Teaching Hospital in the United Kingdom, as he shares some of his experiences as a frontline worker and also some preventive measures in dealing with the coronavirus pandemic. Take a look.
It is good to note that some Nigerian scientists have claimed to have produced locally made reagents, and I think that should form a basis to increase the testing centers in the country, and the government should give all the needed funding for them to validate those reagents and therefore produce more and use it in the country. Another advice I want to give to NCDC and the Nigerian public is that currently it appears that the disease is largely in the urban centers in Nigeria, that is in the cities, and in order to prevent people in the villages from having the disease, those in the urban centers should resist the urge to go back to their villages. This is important because in a country like Nigeria, more of the elderly people live in the rural areas, and it is the elderly people who are more prone to the severe end of the disease and therefore more likely to die from it, as has been well demonstrated in Europe and in America and in the other parts of the world where the disease has done a lot of damage. Therefore, it is important that people are advised to stay in the cities and curtail the transmission of the disease in this environment. It's also important that better reporting of the situation in the country should be encouraged, so that people will know how bad it is in their environment, and that should help them to implement the social distancing measures, which has worked so well in other parts of the world in curtailing the spread of the disease. So things like keeping away from people who are not members of your family, regular washing of hands, and improve better hygiene, and the use of face masks if you have to go into situations where there are people that you do not normally live with. Those are measures that have been shown to improve and reduce the transmission of the disease in the community. And better reporting of the picture of the disease in Nigeria will help the citizens to appreciate the burden of it, and also help them to listen to the social distancing measures that NCDC and the other agencies and the state government and public health staff are advising.
Thank you, Dr. Olorunda. Stop the stigmatization. COVID-19 is not a death sentence. Let's join Dr. Rotimi Jaisimi as he sheds more light.
We are aware of the current pandemic due to COVID-19. The disease has resulted in the death of over 370,000 people globally. Our sympathy goes to the families and friends of the departed. The virus is still very much around, and the number of confirmed cases in Nigeria is rising. Unfortunately, in certain quarters, the disease has been known to carry some stigma. This should not be the case because anybody can get the infection. This message is to encourage people with other underlying conditions to attend a health facility if and when the need arises. Malaria, typhoid, cancer, stroke, heart attack, and even childbirth can result in death. If you feel unwell, or if your diabetes or high blood pressure is uncontrolled, please seek advice and treatment from a health facility. You have to take precautions to minimize the risk of contracting COVID-19 infection. These include the wearing of a face mask, physical distancing, that is, ensuring that there's a distance of about 6 feet between you and another person. In addition, avoid touching your face with your hands and avoid touching surfaces of objects. It is important that if you are unwell, that you seek medical advice and treatment. Stay safe, stay well, and thank you.
Thumbs up to the Nigerian government for keeping to its evacuation by airlifting 268 stranded Nigerians in China this week. All evacuees are currently on compulsory 14-day quarantine as mandated by the Nigerian Center for Disease Control, NCDC, as well as the Federal Ministry of Health. Watch this.
My name is John Adam Smart. I'm from Kaduna State. In 2017, I traveled to Kenya, hoping for a better life than what I have here back home. But it turns out very bad because of documentation issues. I ended up landed me in prison. I spent 6 months in prison. Thanks to NIDCOM, Kaduna State Governor, and Rosalind Ebinobi Foundation, the Nigerian High Commission in Kenya, for facilitating my return back home. We have so much opportunity here back home, and if you ask me, one thing I think I would have done different is to stay back home and use the knowledge, the skills I have to contribute to the growth of Nigeria, which I believe is going to impact other African nations better than living home. So my message is simple. If you have to travel, it has to be necessary, and travel the right way. If not, just stay home. Let's grow home, love home.
The chairman CEO of the Nigerians in Diaspora Commission, Honorable Abike Dabiri Erewa, congratulates Mrs. Omoyemi Akerele. Mrs. Omoyemi is the founder of Lagos Fashion Week, and she has added another feather to her plethora of awards. She has just been announced as member board of directors of the Commonwealth Fashion Council. The fashion body is made up of 54 Commonwealth nations. Congratulations, sister. Keep the Nigerian flag flying. And now we celebrate our dear brother Sesu Uha, also known as Apollo Crew, who recently won the United States Championship World Wrestling Entertainment (WWE). This is said to be his first win as he dethroned the former champion Andrade to win this title in the WWE rings.
Hard work, dedication, and discipline. And I can finally say I've won my first title in WWE.
Gbé fún àpàwọ̀ párò lọ lọ́hùn-ún gba ọdẹ olóko. Aha! Hello, how are you? All right, now I wait for Diaspora and I get stuck with this money. No be you wey dey Bariga or wey dey Mushin or Makoko. Hold up. Yeah. Okay. Una see this link? Now for una waiting for Diaspora. Where see the doubt whether Falu dey Nigeria? Hello, don't think about it. This link, it go carry you direct, go the place where we say it go help you choose which investment you want to do for Nigeria. Any investment, whether na waiting, whether na bank shares, whether na agriculture, whether na real estate, whether na stock exchange, any investment wey you want to do, make sure say you click am because anything fit happen for Diaspora anytime and it go better say if you come Nigeria, you go get where you go relax and you get investment to fall back to. Hello, make sure say you click am because you wan say what? Eh? Wait there. Hey, Oga, see make I help you click the link.
Make you click wetin? When we say na Ambiolo primary school you go, you know here when I talk say na for people wey dey for Diaspora. People wey dey for Diaspora, what are they called? I know they are called diasporans. Oh, there. Let me talk to my diasporans people. Make sure say you click this link. Oh yeah, to betterment your life. Because you both say what the investment in your country in Nigeria is a forever life betterment. Thank you. You see the here. If you like say you don't get job for filling station, you see the here. Go. Look.
Thank you for staying all through the program. It's been worthwhile. And in case you have anything to share with us, please do not hesitate to do so as we expect feedback on our show. Remember, you can reach us on all our social media platforms. On Facebook at Nigerians in Diaspora Commission, on Twitter at nidcom_gov, on our Instagram page at nidcom_gov, and on our website at www.nidcom.gov.ng. You can also join us on DSTV and NTA Networks on Friday at 10:30 a.m., on NTA International on Tuesday at 6 a.m. and 10:05 p.m., on NTA News 24 on Friday at 2:30 p.m., and on Sunday at 11:30 a.m. You can also join us on WAP TV on Monday at 10 p.m. I remain your host, Koinsola Adetumbi. See you next time.